So Essex Law Clinic is an opportunity for students supervised by, practicing solicitors and various other professionals to get involved and put the law that they learned in the books into practice, whether that's client-facing, project work, community work or law reform. There's a lot of things to get involved with and they're all really focused around access to justice. I started working with Essex Law Clinic in my first year. I was able to get involved with a project called the Innocence Project, which works on criminal cases which have been decided and the appeal has been dismissed, and you work on that case trying to exercise the client's last potential opportunity to have their case reviewed. Then in my second year I worked in a project called Beacon House, which works with the homeless community and provides access to justice for them in the sense of ensuring they get the right housing that they are owed by various local authorities or providers. In terms of the work at Beacon House, it really is about going out into the community and being in an environment where people are in a state of desperation in front of you, and the work of the law clinic is something unique in that you can see the weight that you lift from someone's shoulders physically in front of you as it happens, when you're able to address their situation and help them to either find housing, connect back with their family, or just general make progress from the point they are at in their life. And that's a really unique experience to be able to deliver that to someone in person, in front of you, in real time.
My name is Michelle Wilkinson. I'm an advanced nurse practitioner at Beacon House in Colchester, which is the primary healthcare centre for the homeless. Patients come into Beacon House who are homeless. They're seen in the clinic for a full health check, similar to that you'd have at your GP, so height, weight, blood pressure, etc. But we also look into areas such as substance misuse, bloodborne virus testing, sexual health, family planning, mental health, pretty much anything that they might come in or throw at us, we'll try and deal with. Life expectancy for homeless patients is 46 if you're a male and 43 if you're a female. They're more likely to present to A&E and actually not access GP services the same way as which we would. Having a health clinic on site where they're able to get immediate care is actually really beneficial to their health. So in the last 2 years, the Law Clinic have been a big part of the work we've been doing clinically and with the housing team at Beacon House. Prior to the Law Clinic and the students working with us, we were having an issue with getting priority need for our patients, that being that patients who might present with an underlying health condition which we might feel might make them more vulnerable to being left rough sleeping, Colchester Borough Homes would challenge us or would ask us for further information. Quite often that would mean a vulnerable adult might be left on the street for up to a week while the investigations were being carried out, putting their health at risk. With the Law Clinic's interventions, we've managed to challenge most of those decisions and actually change culture. We were given the statute law, the legislation, how to approach the council. We've had various strategic meetings, and actually fundamentally now the culture has changed so that a patient presenting with underlying health conditions who deserves housing on the same day is actually being actioned. So it's really made a difference to lives.
My name's Sarah and I'm an occupational therapist, so I look at meaningful use of our guests' times and how we can improve that and help build independence into their life and enable them to move forward in whichever way we can. So the practical support that the Essex Law Clinic students have given us is arranged meetings via Zoom with the family law advisor, and that has been brilliant because we've been able to support our guests to be able to access amazing advice. So what I think the students gain from coming into Beacon House weekly is a chance and an opportunity to be able to support vulnerable people who really need their support, who maybe don't ever get to access that support elsewhere. And it gives them a chance to experience self-worth, that they are worth fighting for, that there is injustice here. And for the students to experience that is really good, yeah.